Hello everyone, my name is Daniela and I'm a volunteer with For a Safer Space. Today's presentation will continue with the subject of substance use. Part 1 of this topic was covered in a previous presentation. I would like to begin this presentation with a land acknowledgement. I am conducting this presentation on the traditional territory of the Mississaugas of Scugog Island. While it is important to acknowledge which land I'm on, it is equally as important to understand why we engage in a land acknowledgement. First, acknowledging the land is an act of decolonization. Decolonization is an act that aims to reverse colonialism. It is also significant in understanding history and acknowledging history, as well as showing respect for indigenous peoples and their relationship to the land. However, it is important to not only use a land acknowledgement, but to educate ourselves on historical and current issues, stand with indigenous peoples in the pursuit of social justice, and decolonize our thoughts and actions. Today's agenda will include a recap on substance use part 1, then we'll discuss language, misconceptions about substance use disorder, coping with substance use disorder, supporting someone living with substance use disorder, supporting a client, the opioid crisis, harm reduction, resources, and finally we'll conclude with some key takeaways. In the last video, we focused more on biological processes and medical and therapy-based forms of treatment. This will differ in this video, however, which will focus more on substance use in terms of social justice, coping, and supporting people living with SUD. We will begin this video with a brief recap of the first part. While similar, there are differences between substance misuse, abuse, and addiction, which are significant to understand as the severity of the circumstances differ. With substance misuse and substance use disorder, or SUD, the difference is intent. With SUD and severe SUD, the difference is control. Substance use can be viewed on a spectrum, and individuals can fluctuate between their placements on this spectrum. There are various risk factors for SUD, including family history, mental illnesses, peer pressure, family problems, early use, and the use of highly addictive substances. There are different warning signs for SUD, which can be broken up into 3 categories: physical warning signs, behavioral warning signs, and psychological warning signs. It is important to understand the prevalence of comorbidities between SUD and other mental illnesses. There are a few ways that substance use can impact the brain, leading to cycles of addiction, mainly through 2 processes: reward and withdrawal. Treatments for SUD include detoxification, inpatient or outpatient rehab programs, and psychotherapy. Now we will deconstruct language, which is an important step in lessening stigma. This is significant as stigmatizing language can alter the way individuals see themselves and whether or not they reach out for support. Stigmatizing language can include prejudice through making connections between substance use and a person who uses substances, belittling someone's value, or using labels as a way to dehumanize. Language rooted in stigma can also impact people when they are seeking resources. In fact, many avoid resources for fears of stigma and potential labels. As well, research demonstrates that words like addict create disparities in individuals' access to services. Finally, this can also impact policies that are created. When using language, person-first language is the best. Person-first language can look like person who uses substances. This language can be unbiased, destigmatized, and promote changes in the way various individuals and society views those who use substances. Misconceptions about substance use disorder. There are various misconceptions surrounding SUD, and we will take a couple of minutes to deconstruct them. This is an important step in better understanding the mental illness and deconstructing the stigma around it, as these misconceptions spread misinformation and can stereotype individuals living with a mental illness. The first misconception is, to overcome addiction, someone just needs strength and positivity. Substance use changes the way the brain works. As discussed in part 1 of this presentation, there is a cycle of reward and avoidance of withdrawal symptoms, which results in severe cravings and loss of impulse control. This can make it difficult for individuals to manage SUD, even if they have every intention to quit. People will not get help until they hit rock bottom. Steps to recover can start at any point. Given the relationship between the brain and consequences of SUD, it can be important that treatments are done sooner rather than later. This misconception can be harmful as it can result in people postponing treatment or support as they do not feel that they should reach out yet. Next is, since SUD is a disease, there is not much that can be done. While SUD is evident to be based in the brain, there are possibilities of reversing this through various means. Some examples of options available were discussed in part 1 of this presentation, and harm reduction will be discussed on a later slide. finally, SUD can impact someone throughout their life. SUD is different per person. Some may live with the condition for years, and someone else may find that they respond to treatments faster. The ultimate goal is that with appropriate supports, someone can regain control to live a normal and productive life. There are various ways that someone can cope with SUD. These coping mechanisms can assist in managing SUD and coping with different factors that led to substance use, such as negative emotions, stress, peer pressure, trauma, mental illness, or other factors. It is important to know that not all methods will benefit everyone, as each individual and their lived experiences differ. What's important is that coping mechanisms that work for the individual are found. However, a few different coping methods that others have found beneficial will be discussed, but this is obviously not a complete list. The first is, when something stressful happens, pause before reacting. Taking a moment to breathe and clear their mind can be beneficial, as situations can be approached with better control. Another technique is meditation and mindfulness. This can help with finding the present moment and coping with negative emotions. Keeping busy. It can be important to replace substance use with positive actions and behaviors. Creating and working on a to-do list, watching TV, reading, or other activities the individual enjoyed prior can all help to keep busy. Watch physical health. Taking care of physical health, especially after substance use, is significant. Ensuring they eat enough and well, while also adding exercise into routines, can be beneficial. This can also help with emotional well-being, as emotions, while not entirely reliant on physical health, can be improved through watching physical health. Journaling. Many people use journaling as a coping mechanism. Writing down negative thoughts and feelings can help to get thoughts on paper rather than internalizing them. Reach out. Reaching out to a peer or professional can be beneficial. They can provide a safe space to talk about anything the individual may be struggling with and can help to work through them. Create a support network. Having people around the individual that can offer support can be helpful in reminding them that they are not alone. Being open to starting new relationships, even with those with similar lived experiences, can also be beneficial to the support network. And finally, gratitude. Many people say that gratitude was key to recovery, as it can be empowering. They can remind themselves of who is in their corner and how far they have come. Supporting someone living with substance use disorder. With SUD, what is difficult is that others can be impacted as well by the mental illness, even when they are not living with it. However, there are ways to support someone living with SUD, including educating yourself. Learning about SUD, the processes, and its relationship can be impactful. It will help to better understand the relationships between reward and the brain to explain why it can be difficult for people to stop utilizing substances. Avoid enabling. Sometimes without realizing, people have enabled others, for instance by paying legal fees. It is important that individuals living with SUD are not enabled through this, as they do not face consequences for their actions. SUD can be an explanation for behavior, but it is not an excuse. However, with this said, it can still be important to lead with empathy. Set realistic expectations. Hold the individual accountable and offer assistance in finding supports. Listen. Listening can seem obvious, but can be more difficult than many think. Active listening, while centering validation and empathy, can be key, as someone's not enabling and accepting negative behaviors, but still offering support. And finally, find support in self-care. Knowing someone living with SUD can also impact that person's life. There are supports available to loved ones of those living with SUD, and it can be important to find these supports if needed. It is also important that they center their own needs and life, as well as ensure boundaries are kept. Supporting a client. There are various steps to take and important considerations for practitioners that can benefit them when working with a client living with SUD. We will spend a couple of minutes discussing these. The first is be an ally. Finding professional help for SUD is difficult, and clients need to have the ability to trust the practitioner. Creating strong bonds with clients can be significant for this and will reinforce to the client that the practitioner is there to support them. It may take time for this trusting relationship to form. However, when it does, clients should eventually be able to openly speak and communicate with practitioners. Some ways to achieve this include demonstrating interest in their well-being, actively listening, showing empathy, open communication about what roadblocks might impact recovery. Next is encourage recovery. It can be difficult for individuals living with SUD to recover. However, it is important. Many individuals may even struggle to recognize their own patterns or may not be ready to quit. While practitioners can encourage recovery, do not force it. If they're not ready, discuss harm reduction strategies. More on this will be discussed on a later slide. What is key is ensuring support for their own self-determination while remaining motivational that change is possible if they want to work towards it. Develop relapse prevention plans. Due to the processes associated with SUD, many experience relapses. Reinforce that this is not a failure, but an opportunity to adjust what is needed. Creating a plan for potential relapses can be beneficial. However, each plan will differ per person. Some important things to consider include warning signs and how to manage them, a list of their support network, an emergency plan, and changes to lifestyle that may be beneficial. And finally, discuss support groups. Support groups can provide clients with a group or individuals with similar lived experiences. They can provide another source of accountability and a larger support network for the individual. Opioid Crisis. Currently, Canada finds itself in an opioid crisis. Between January 2016 and December 2018, it is estimated that there were more than 11,500 opioid-related deaths. Therefore, it has become an increasing concern for public health and safety. Opioids can be both legal and illegal substances. For instance, legal opioids can be prescription drugs. However, some individuals do not report problematic use of these drugs due to their effect. With the increase in opioid-related deaths and the rates of substance use, the Canadian government is working with different groups to create a balanced plan to improve policies related to substance use. In this next section, we will discuss the basics around harm reduction. Harm reduction is critical to social justice and creating safe spaces for those living with SUD. Topics to be covered include what is harm reduction, why is it important, and harm reduction resources. What is harm reduction? Harm reduction can be defined as methods and ideas that minimize adverse consequences connected to substance use. It is also labeled as a movement for social justice that highlights respect, believing in, and the rights of those who use substances. Harm reduction can include various types of methods, which center safer use, managed use, abstinence, meeting people where they're at, and acknowledging the conditions of use and use itself. Due to harm reduction's focus on centering those who use substances, individual and community needs, there are different ways of doing harm reduction. Many individuals assume that harm reduction supports substance use, although it actually supports the ideology that dignity and respect are key, and individuals should be offered wider treatments in order to make decisions for themselves. Although, with this said, the National Harm Reduction Coalition proposes principles for harm reduction, which includes acceptance for the prevalence of substance use and focusing on limiting the adverse impacts in lieu of looking down or ignoring them, acknowledge that substance use can be complex and exists on a spectrum. However, there are ways of utilizing substances that can be safer than others, create a quality of well-being, center non-judgment, non-forceful services and resources to minimize harm, center the voices of those who either use or have used substances when forming programs that will be used by them. Be affirming in that those who use substances are at the forefront of reducing harm and that they are empowered to provide knowledge and support to others. Acknowledge that poverty, class, racism, social isolation, past trauma, gender discrimination, and other social factors and oppressions can impact an individual's probability for substance use or their ability to manage harm. And finally, avoids belittling or ignoring the harm and danger in illegal substance use. Why is it important? There are various reasons that connect to why harm reduction is so important. First, harm reduction is social justice. As it focuses on centering empathy and self-determination, harm reduction focuses more on the rights of individuals who use substances rather than stopping substance use. By focusing on these rights, individuals are not forced into treatments or doing something that they may not be in the right place for. This is social justice as it ties directly to these rights of self-determination, and individuals can make choices for themselves that reflect their own needs, rather than having forced treatments and solutions that may not benefit them and the rights of individuals who use substances. It also considers the impacts of intersectionality in various circumstances. Through the principles mentioned earlier, harm reduction puts different identity factors and circumstances at the forefront, in order to understand why individuals may first use substances, continue using substances, or may have difficulties abstaining from them. This intersectional and critical approach to looking at substance use can be key in ensuring that people can lead with empathy through harm reduction approaches. And finally, harm reduction saves lives. As harm reduction focuses more on minimizing adverse impacts and ensuring safer substance use, it reduces the chances of more unsafe options. This saves lives as others can choose paths that are right for them and can have services and programs that they can rely on and are more likely to seek out. Harm reduction resources. There are different programs and resources available for both community members and those who use substances. We will discuss a few of these options as they are important steps in harm reduction. The first is education for community members. Naloxone training programs and kits are available to many. In fact, different organizations or even pharmacies hand out kits for individuals to use. The intention of this is that people can use naloxone in the event someone overdoses on opioids. Needle distribution programs. This is used to reduce HIV and hepatitis C infections by offering individuals sterile injection equipment. Studies show that this does not increase substance use, but can increase the use of other helpful services. Known as supervised consumption sites, these services offer a place for individuals to safely utilize illegal substances without worry of being arrested and under supervision of trained workers. Medication-assisted treatment, or MAT. Methadone and buprenorphine may be used to lessen cravings for opiates. Peer programs. This provides a safe space for both people who currently use substances and those who have used them to be at the center of creating programs. Non-abstinence housing. Housing like this provides safe housing to individuals who are homeless or underhoused, without needing them to abstain from using illegal substances. Finally, there are drug testing sites. These can be critical and offer anonymous testing for drugs, which can look for substances such as fentanyl. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude this video with some key takeaways. It is important to keep language used in mind as it can have adverse impacts on people who use substances. There are various misconceptions about SUD which can perpetuate harmful stereotypes and stigmas that impact individuals. There are ways to cope with SUD, however, as all methods do not work for everyone, it is important to find methods that work for the individual. There are ways to support someone living with SUD, but it is critical that they center self-care and their own well-being. Practitioners can support clients living with SUD in a variety of effective ways. To continue with some key takeaways, the opioid crisis is a public health and safety concern that occurred after the increase in opioid-related overdoses. Harm reduction provides methods and ideas that minimize adverse consequences connected to substance use. There is no one way to practice harm reduction due to the individuality of communities and people it serves. Harm reduction is critical as it saves lives and centers social justice. There are various harm reduction resources that can be used by individuals who use substances to ensure safe substance use and minimize harm. That concludes part 2 of this 2-part presentation on substance use. Thank you for watching.